Hello, I'm Dr. Savitha Soman, Additional Professor and Unit Head in the Department of Psychiatry at Kasturba Hospital, Manipal. I'm here today to talk to you about a very common symptom that all of us are aware of, anxiety. So all of us know about anxiety. All of us have suffered from it at some point of time or the other. Some of us suffer a little more, some of us suffer a little less. Anxiety is not always bad. Sometimes a bit of anxiety can help you perform better. However, there's always this adage about too much of a good thing. So if your anxiety is beyond what is considered normal or what is considered acceptable, then it can cause a lot of distress to you, to your loved ones, as well as affect your functioning and performance. So there are different types of anxiety disorders that are prevalent. So you have the generalized anxiety disorder, you have social anxiety disorder, you have phobias, you have health anxiety, you have performance anxiety. So there are different types of anxiety that have been described. Today we will talk about something that's quite common, which often does not come to clinical attention very much because a lot of people suffer in silence and they don't report it. This is the condition of social anxiety disorder. So social anxiety disorder, as the name implies, is an anxiety condition in which individuals who suffer from this fear social interactions or social situations, and they try to avoid these situations as much as possible. Now, this must not be confused with shyness. Shyness is basically a very common and a normal personality characteristic. Shy individuals take their own time in starting to interact with people, especially whom they do not know very well. However, they do not suffer from this intense fear that people with social anxiety have, nor do they try and avoid these situations actively. So what are the common symptoms and signs that one can see in a person with social anxiety disorder? So as already mentioned, these individuals have intense fear about facing social situations and being in social situations. Now, this could include having a conversation with somebody, especially in a group and especially with people whom they do not know very well or with authority figures. It could mean having to do an activity while being observed, for example, eating in public, drinking in public, having to sign a document while being watched by somebody else, having to walk into a room where several others are already seated, or giving a public talk or a public performance. People with social anxiety have this fear that they may say something or do something which would cast them in an embarrassing or a bad light, and this would lead to others negatively evaluating them. So this leads to a very real fear of getting humiliated, embarrassed, or rejected. This fear persists across most social situations, so much so that the person tries to avoid these situations as much as possible, or when it is not at all possible to avoid them, the person endures it with maximum distress. So having said so much about social anxiety disorder and the difficulties that a person with social anxiety disorder can face, what can one do if one has social anxiety disorder? So social anxiety disorder, if left untreated, can not only have a significant impact on one's social life, but it can also bring down the overall general quality of life because you are prevented from doing a lot of things that you would like to do because of this intense anxiety. You're prevented from interacting with people, you're prevented from maybe making friends, attending social gatherings, etc. However, the good news is that nobody needs to suffer in silence with social anxiety disorder. It is a treatable condition, and you have a team of mental health specialists who can help you get rid or relieve you of the symptoms of this condition. The symptoms of social anxiety disorder respond very well to a combination of anti-anxiety medications as well as psychological therapy. So if you or anyone you know or any of your loved ones is suffering from this distressing condition of social anxiety disorder, now you know what to do about it, and that's half the battle won. Thank you.